So the tactical times to use the RMT. One is before cows go into supply at calving. You don't want to put any cows in supply with a high cell count because that can make you have a cell count grade. So they should be RMT tested before they go into supply. Another time to use it is if you're having a high cell count in your bulk tank and you're not going to do a herd test because you don't have enough cows in supply for it to be worthwhile. You would want to go through and RMT every single cow in the herd to identify those that have very high cell counts and remove them from supply so you can continue to supply milk that's below 400,000. And another tactical way to use the RMT is after you herd test to identify which quarters are infected, because the herd test only tells you that a cow has a high cell count, not which quarter has a high cell count. And then you can address the quarter with a culture to determine what to do next with it. A fourth use for the RMT is at dry off to determine which quarters you want to treat with dry cow therapy and which quarters you're not going to treat with dry cow therapy. When you have a high cell count, it's helpful to strip the herd if you think you've got clinical cases that you've missed. But if you don't have any clinical cases and your filter stock is clean, the best method is to either do an RMT of the whole herd or do a herd test and then RMT the positive cows to find the infected quarters. There are other technologies available that identify subclinical mastitis or claim to identify subclinical mastitis. Most commonly used is conductivity. They're not very sensitive to high cell count and they're not nearly as accurate as an RMT in identifying cows with high cell counts. Logan's done a really, really good job on disinfecting the teat. I'd put that teat in my mouth. That's how clean it is.